welcome today to be here, and we're really glad to have Allison Foster, who brought a guest, because ahead of the time we talk about it, that what we can do have something that fit us, because each of our university is different. SOPHAS is just, you'll see, I won't say very much because I'm in the learning process also. It's just online application for the graduate program. So I think the program itself will allow us to be much more visible, first place and second place, much more unified for all of us. At least that's my vision and how I see it. So with that, people often, individual program come to me and say, Tammy, can I have a little money to do this? So I said, what do you want to do? We want to advertise so we can get more applicants. And I just said, so not right now. Look at this first. Then maybe you can see something different from what you're envisioned from your perspective. So I'm just so pleased that we got a beautiful weather, beautiful flowers, and all that just for our guests. I'm going to ask you to introduce our guests, two more, and Allison and Gus. I know you must be very passionate about what this is it. That's why you will come and share all the good news for this information with us. So with that, Allison, would you enlighten us and educate all of us?
Absolutely.
So we can see what we can do.
Absolutely. So we'll introduce ourselves, and what I'm going to do is turn off the mic for a couple of minutes, and we'd like for you all to introduce yourselves to us so that we can understand who's in the audience, make sure that we're sort of presenting the right things that might be of interest to you, and then I'll turn the mic back on and then we'll actually start with the presentation. Okay, so I'm Allison Foster. I'm the Deputy Executive Director of the Association of Schools and Programs of Public Health, and we're thrilled to have Oregon State as one of our members. You've been an affiliate member or associate member of ours for several years now, but soon to be a fully accredited member. Yes. So congratulations in advance.
And I'm Andrea Rex, Assistant Dean for Student Services at the UC Berkeley School of Public Health.
And I'm Guy Piotrowski. I'm Coordinator for Applications and Admissions at the University of Minnesota School of Public Health.
Welcome.
Okay. So if we could just go around and just really quickly tell us what your name is and your title, your role. So like I said, it'll really help us to figure out what exactly we're going to present this morning, because we didn't know who's going to be the audience. So hopefully we'll do a better job. So maybe we could start with Marie, who we've had the pleasure to spend some time with this morning.
So you know who I am, and thank you again for coming. We so appreciate it.
Great. Brave, the Dean, again. Thank you and welcome.
Eileen Casper, Graduate Programs Manager for the Public Health Disciplines and Assistant to Marie.
Joanne Hunage, Accreditation and Assessment Manager.
Gloria Cron, Director of External Relations, UC alum, and grew up just north of Minnesota. How much further north can you get? Canada's right.
My name's Tim. I'm a third year at the Human Development and Family Studies program, and I serve on the Graduate Student Council.
Okay, great.
Jeff Bethel, faculty.
Okay.
Jeff Lund, faculty in Health Management Policy.
Catherine Clevenger in Dean's office.
Steph Burnell, we met this morning.
Yeah.
I'm Cheryl Thorpe, and I'm co-director of the School of Social and Behavioral Health Sciences, which includes the academic programs in Human Development, Family Sciences, Health Management, Policy, and Health Promotion, Health Behavior.
That's a long title.
Yeah.
I'm Catherine Struffel, and I'm Director of Marketing and Communications for the college.
Rory Vanguard, PhD student.
Okay.
Sue Cruz, I'm the track coordinator for epidemiology.
And Blue Barnes from the Graduate School. I do international relations.
Yep, great.
And I'm Ann Hudson, the Research Program Coordinator.
Okay, so some of you are more familiar with SOPHAS than others, so I think what we'll do is start with some basic little history, sort of how decisions are made about SOPHAS, who the players are, and then we're going to give you a little demo of what the system looks like, and talk about a few other things. So let me see. Okay, so we won't spend a lot of time on this, but SOPHAS was launched in 2005. So it's something ASPPH has been offering as a membership service for about 10 years. Originally, it was actually created for the schools, by the schools. We brought a number of schools of public health together, and they sat around in a room on several occasions for a couple days at a time and talked about what would a centralized application service for public health look like. And at the time, it was kind of a big deal because public health is very, very, very broad. And there were those that said it couldn't be done, but obviously it can be done, and it's been a great service. So we started with 22 schools of public health. And when it first launched, it was just an application, and we'll show you that it's much, much more than that now, but it has evolved quite a bit over time and will continue to evolve. So what SOPHAS is today is not what it's going to be a year from now, 2 years from now, and it keeps getting better and better. So today we actually have 64 participating institutions in SOPHAS, and I think we're going to have about 11 more join next year. So we usually have about an 80-85% participation rate of the ASPPH members. We're just always excited to have new schools and programs join SOPHAS. So one thing that we've added to SOPHAS, and I'm just going to throw this in here now, just to make sure that you know what this is. We will keep mentioning WebAdmit, and we're actually going to show you what WebAdmit looks like. WebAdmit is the admissions portal, and that was added to the service in another form about 4 years ago, I believe. And so now applicants can apply through SOPHAS, but you can do all of your admissions management reviews and even make offers to applicants all through WebAdmit. So it's a sort of one-stop shopping for admissions in addition to one-stop shopping for applicants. And so Guy will give you a demo and show you some really neat things you could do with WebAdmit. But I will say you've actually got some really, really great resources here on campus, and Eileen is sort of a resident expert in how WebAdmit works, and a number of you. So Guy might show you another way to look at WebAdmit, but you guys are actually doing a great job using the system already. So I have to give you kudos for that. Okay. So SOPHAS certainly has increased the number of applicants, over the years. And as you can see in our first cycle, we had, well, maybe you can't see, it's a little light here. We had 6,000 applicants in the end of the first cycle. Right now we have, I believe, 13,900 completed applicants in this cycle, and we're got a couple more months to go. So SOPHAS does continue to grow. And it's for a couple of reasons. One is I believe that public health is growing as a field. The number of SEEP-accredited schools in public health and ASPPH members continues to grow. But we also do quite a bit of recruiting for SOPHAS on behalf of the schools and programs. So we are trying to get more people interested in SOPHAS. So definitely growth, has been a trend, and we hope this will continue over time. So SOPHAS is a member, as I mentioned, it is a member benefit for members of ASPPH. So it is our service that we offer. However, our office is, we're just under 40 staff. We do not actually run SOPHAS on a day-to-day basis. We partner with a company called Liaison International that's based in Boston, Massachusetts, and Liaison actually runs SOPHAS on a day-to-day basis. So they have, I'd say they have a little over 200 staff now. They're a pretty big operation. So they create all the software for SOPHAS. They run the day-to-day operations. So if an applicant calls SOPHAS, emails SOPHAS, they're the customer service that responds, and they really head up the technology, and they implement the way SOPHAS should work. ASPPH, my role is to convene the schools and programs to decide how SOPHAS should work. So Liaison doesn't make any decisions. So a lot of things we're going to talk about today, it was the reason why we do everything we do, the reason we collect what we collect, the reason why you see things when you see them is because the schools and programs got together on many, like I said, many occasions and decided this is how SOPHAS should work. And then we let our partner, Liaison, know, and then they just carry out the policies. So SOPHAS is not a plug-in. It was just, like I said, it was a service that was actually created for the schools, by the schools. And it's an evolving process. So we meet twice a year in person to spend a lot of time with all the schools and programs about what, how SOPHAS should work. So we do make changes, partly because we're learning and growing and becoming a little more sophisticated. Technology has changed. The applicant pool has changed. So SOPHAS will continue to grow and evolve. And it's important that all of our participating members do participate in these discussions, because SOPHAS has got to work for everybody. So we need everyone at the table, and even we encourage non-participating members to participate in those conversations as well. So just one more note, but Liaison, I mentioned they are our vendor. We do have a contract with them, but they are really more of just a wonderful partner. They're a terrific company. They're just ahead of many of the other software companies, and they really have our best interests in heart. So we really enjoy working with their staff, and they've just been incredibly loyal to us and done a lot of great things for us and helped push us along. One of the benefits of working with Liaison in particular is that they manage, I believe it's 27, I couldn't fit 27 logos here, but they manage actually 27 other application services all in the health professions. So one really nice benefit is that I have a colleague at each of these other application services, and most of them are actually, I'm in DC, most of them are actually in DC, so we meet quarterly to talk about how does your application service running, or what changes are you thinking about making? Have your members talked about this? So really, all of these services are growing together. We are getting a lot of cross-fertilization of ideas. The IT folks on each of the campuses loves that, because many of our SOPHAS members have other application services managed by Liaison on campus. And so the IT folks don't have to recreate the wheel when it comes to looking at the data. A lot of times we have system users or admissions directors who actually manage multiple services, and they're basically working, very much in the same platform in their application services. So the fact that Liaison manages all these other services is good for the members. It's also really good for the staff, and it's good for the application services.
Is pharmacy on?
Pharmacy is. Yeah, I don't know. Like I said, I was just running out of room. But your pharmacy program is in PharmCast. Okay. Your your veterinary medicine program is in VinCast, and then you have a postdoc psychology internship program here on campus. And that's actually in, can't say the acronym, but they are participating as well. So you do have some colleagues on campus that have already got some experience with Liaison and a Liaison managed cast. So when we launched SOPHAS, like I said, we brought every interested school and program together in a room, and did really great. There's just the public health folks are fantastic to work with, so it worked really, really well, just to bring everybody together and talk through how should this work. But over time, as we've grown, that was a little more difficult to fit everybody in a room. With, we've got 90-some members. So a couple of years ago, we created an advisory council that has worked really nicely. So we have 7 members of an advisory council, 2 of which are here. Guy is the immediate past chair, and Andrea Rex is the West Coast representative. And so these folks spend a lot of time really thinking through the suggestions, the ideas. They each are assigned a regional group of schools and programs, and they hold conference calls with those regional schools and programs to really, get the user input, to talk things through, to share best practices. That's probably the best benefit of SOPHAS. It's just the camaraderie between the schools and programs. It's absolutely amazing, and I'll tell you, we've actually had 3 SOPHAS weddings. That's how close this group is.
It's all that data sharing.
Yeah, I guess. But it's absolutely amazing. So the schools and programs really rely on each other, and to see, how often they reach out to each other and say, hey, did you have this problem, or what happened with this? And it's just this constant communication. So the regional groups have really facilitated that. So Andrea and Guy and their colleagues are really their first point of contact for participating schools and programs who maybe want to suggest a change, or have questions. They go to their advisory council representative. So these folks are all elected, so it's a democracy, and they're just a pleasure to work with. So I can say on camera, thank you to Guy and Andrea for all your hard work. So we do continue to meet. Our meetings, it's kind of nice, we're getting a little bit shorter, the business segment, and we're spending more time on best practices and strategic direction, because SOPHAS is working really well. So it's more our discussions have become much more strategic lately, which I think is a great sign. So we do meet at APHA every year, and I know a number of you do attend, for about a 6-hour meeting. And then we also meet every spring, and next year it's going to be in conjunction with the annual meeting of ASPPH. And we, of course, have conference calls, doesn't everybody? And then we also do lots and lots of webinar trainings. The technology is just great. So we do a lot of best practices, webinar trainings, as well as trainings to review sort of upcoming changes, for example. Okay. So just a couple guidelines I thought I'd just mention, because there are not a lot of guidelines. SOPHAS was designed to be flexible so that it would work for each of our members. So each school and program gets to decide which of its academic programs will participate in the system. The only rule we have is that an applicant cannot make the decision, how will I apply to participating programs. You could certainly have a supplemental application, but the applicant cannot pick and choose, will I apply to SOPHAS or will I apply to directly to school? They either apply to SOPHAS or they apply to both. That's your choice. But that's really the only hard and fast rule we have. But you can, of course, decide what participates. You can have as many deadlines as you want, and we'll show you a couple of the other tools that we have to make sure that SOPHAS is flexible and meets your needs. And we also do not charge. There is a fee for applicants, not a fee for our participating members. So Oregon State doesn't pay anything to participate in SOPHAS. So one great benefit also of SOPHAS is that for the first time ever, ASPPH had a list, basically, of all the degree programs at schools of public health. We never had that before, so this was pretty terrific. And in the first couple of years, we had spreadsheets we'd post online, and that was just awful, because what do you do with 42 spreadsheets if you're an applicant? So a number of years ago, we launched a program search. And we now encourage all of our members, SOPHAS and non-SOPHAS, to add their designations to the program search. So, we will make sure that you all have everything you offer in the program search, because this is the most popular page on our website. It's basically free advertising. We're about to launch a whole new version of the program search in June. So if you go back to our website in June, it will look nothing like this. But the applicant can search for type of degrees or specific degrees. We had search tags by program area, or they want a Peace Corps program or executive program, et cetera, et cetera. So it's just a really, really terrific tool. And the information is controlled by you. So several folks here on campus have a login to a portal where they can actually manage all that information. So there's no clearinghouse on our end. You directly manage what's in the search. So we recently went through and did a cleanup of all of the SOPHAS designations, because we're getting ready to launch another cycle. There were 3,085 designations in our search. And my colleague and I went through every single one of them to clean up the search tags, and that was a bear. But one thing we thought was really interesting, because it'd been a while since we actually looked at each and every single one, is that we noticed that there were a lot of really interesting programs in SOPHAS. So I just wanted to point these out, because you do have, you've got your exercise science, and you've got your human development and nutrition programs. You can read, so I'll just let you take a look at these. So these were just some that I grabbed because I thought they were interesting, that are participating in SOPHAS. Okay. And this is the one that you cannot find our search right now because they're in the process of adding it, but as you can see, Bloomington has got a lot of programs that are not traditional public health, and they're going to be participating in SOPHAS. And the number one reason why is for efficiency, because they have all their data for applicants in the same place and use one single system. So it's just much more efficient. But it's also great advertising. They get a lot of exposure, by virtue of the fact that we do that and do lots and lots of recruiting. So we are encouraging our members to add as much as you can to SOPHAS, because like I said, it's much more efficient, and it is good awareness. So we're going to talk a little bit about our SOPHAS member experiences. Well, certainly there are benefits for applicants who participate in or apply through SOPHAS. Certainly, if they're going to apply to more than one program, it's much more efficient because they only have to apply once, which is great. And we spend a lot of time working with applicants to make sure that SOPHAS works well for them. So in fact, at the beginning of every meeting, we go through some strategic goals, and they are basically to make the application process as simple and clear as possible for applicants. And every change we make, we do come back to the question, is this good for applicants? Because it would be really easy to get all immersed in, the admissions process and collect gobs and gobs of questions that aren't necessary and add more time onto the applicant process. And so we always sort of vet every decision we make from the applicant perspective. In fact, we survey applicants a couple times a year. We do we occasionally do focus groups with applicants. We had one last summer and brought them in and talked to them for an entire day. It's really interesting about how we could make the service work better for them. We've got some great ideas, and by 2015, they're going to make some huge changes to the applicant portal based on their feedback. So the applicant is always, a very important constituent in this conversation. So I'm actually going to hand the mic to my colleagues, Guy and Andrea, and ask them to talk about how SOPHAS has benefited their programs.
So we have been in SOPHAS since the beginning. Minnesota has been in SOPHAS since the beginning, so this is our 8th cycle. I'll let you know when we started in SOPHAS. We got about 400 applications a year, and currently we get 1,500 to 1,700 applications a year. So it really increased our visibility, especially with applicants on each coast who we never got a lot of applications from. We pretty much were upper Midwest. And so that's been wonderful for us. And in the beginning, it didn't lend itself to actually getting the great applicants from the coasts to come to us. We'd admit them, but they wouldn't come. But that has changed over the years in working at SOPHAS. One of my favorite stories is that it used to be, it was always the majority of our applications, or matriculations, I should say, came from Minnesota, of course, and then the next state was Wisconsin. Well, that's not the case anymore. Now it's Minnesota, California, Wisconsin. And so it has changed the diversity of our student population. In terms of, I work with all the applications. I look at them first, and then they go out to the actual programs. WebAdmit has made things very, very simple and easy for me to try to manage 1,500 applications, and so I couldn't be happier with it. And plus, I really like these people.
And I came to UC Berkeley 3.5 years ago. So SOPHAS had already launched, and they had already done their implementation, and it was my predecessor who got people on board. But what I've gotten to notice, not only do I just love the data that comes in, and it helps me realize I get to make better decisions about my recruitment strategies, where I should spend my money and where I shouldn't, who actually matrix versus it applies. And then, in spring 2012, we launched UC Berkeley's first online degree altogether, which happened to be an online MPH. And due to the SOPHAS cycles, I chose to keep those applications separate, and we would just have them go through our campus system, while our campus students always just come through SOPHAS and the campus system. And I have found that my faculty, who review both for the campus once a year and then they review for the online program 3 times a year, are really struggling not getting the same information, the same interface that they now have grown to love and get very used to in SOPHAS. So I'm thinking about ways that I can go ahead and get my online students to come through SOPHAS so that every review committee, whether it's happening in January or in June, is getting to see the same standardized data. You get the same GPAs. If you want to see your biostats GPAs, you can see those. If you just want to look at math, you can look at that. And so that's been a huge education to me, to see just how unhappy the faculty have become with how they used to do things. So.
Okay. So the number one reason why ASPPH started SOPHAS a number of years ago is because of the data. The data that we received previously that was self-reported by the schools and programs there was not a lot of depth to it, and it was also very redundant. We couldn't see how many applicants there were to public health. because all we got was a number. So the data was very, very important to us, but I know that it's very important to you. So a couple things. One is that at the end of every cycle after you participate, and you all have this to look forward to this coming fall, is all the participating members send us their decisions, the applicant action. Did you make them an offer? Did they matriculate? And then I will send back to you a report that shows for everybody that accepted, did they decline at another institution? And for everybody who turned you down, they got an offer and did not come, did they end up matriculating in another school and program? So you can, frankly, see who your competitors are. It's great. We do it on a department-by-department basis. There were a lot of surprises the first year we did it because everybody thought, I know who my competitors are. Oh, no. So normally I'd let them tell a story, but since I got the mic. So it turns out that Berkeley, Emory, and Minnesota are competitors of each, and Michigan. They're sort of in a pool. They share the same applicants, and who knew? So
Berkeley,
Emory, Michigan, and Minnesota.
And we always knew that Michigan was a competitor, but we never dreamed that Emory and Berkeley were.
And we don't know why. We haven't figured that out yet. But they share such a big population that the really neat thing is not only do they know this, they're now going out and recruiting together. They're doing they do a powerhouse show, and they go out and do a four school panel. I mean, how great is that? That just shows you the power of collaboration. Instead of saying, oh, you're my competitor, now they're saying, well, let's go meet all these student groups together because we're going to meet with them individually. So it's just absolutely fantastic to have this data. We do send out applicant profiles. It's a pretty detailed report that has trends, really shows you who the applicants are, what they look like. Through WebAdmit, you can run some comparative reports. You can compare your school, some statistics about your applicant pool with the entire national pool. However, and maybe if we have time, Guy can show you. Let me see. I'll come back to that. This fall, ASPPH is going to be launching something called Tableau. I talked about this in an earlier meeting. Which will allow you all to run your own reports and manipulate the data. And they're not just bar charts. Tableau uses data visualization to show really complex data in really simple ways. So you will be able to play around with your data, run whatever is of interest to you. You can run your own, but it also will allow you to run comparative reports so you can compare your applicant pool statistics. Then you can figure out who your cohorts are, who your competitor schools are, so you can decide. I think we'll have a minimum, probably 5, but you can pick the 5 or more schools, run their statistics, and see where you stand versus the folks that you consider your competitors. So I think that this is going to be just huge, just the power of putting the data in your hands. So that should be up and running by fall, and then these were just examples of sort of what Tableau can do. So this is the kind of thing you all have to look forward to. Yeah. So as I mentioned earlier, so ASPPH is the membership association are really starting to put some efforts together in recruiting. We've always done a little recruiting, but frankly we've been a little lazy because public health has been a growing field and we haven't had to. But I think that just given demographics, given the student debt load, I think we need to work a little harder to make sure that we continue to get the applicants that you all want. So we've actually recently hired a full-time recruiting manager and are trying a lot of new things. We're going to fall on our face a few times on some of these things, but so far we've had a few I think were just a home run. So we're doing a lot more in-person presentations, but we're also doing virtual fairs. We're coming up with some all-new marketing materials. That if you participate, we are in SOPHAS, but if you continue to participate in SOPHAS, that anything ASPPH has, as far as marketing materials, brochures, pens, any of the conference giveaway materials, are yours for free. So you just have to email me or my colleague and say, I'd like a box of X, and we will ship it to you. So it's yours to use, and we want you to get that material out there. So that's a benefit we hope you will take benefit of. We do have a recruiting subcommittee, so if this is an area you all really want to get engaged in the conversation and brainstorm and think of new ideas, then you're very welcome to join our recruitment subcommittee. And I do send out updates about once every 1 or 2 weeks. And anything new with recruiting is in that update. So any of you that are interested, let me know and I'll sign you up and you'll hear from me periodically. Okay, so who has been in SOPHAS? Okay, so you've set up test accounts. Okay, great.
Oh no, not from an applicant, only from reviewing applicants.
Oh, okay, all right. You've been in the applicant portal?
No, reviewer.
No, okay, all right. Anybody else? Okay. Eileen has. Good. All right, India. Okay. So, would you like us to hop off on the internet for a second and then just show you what the application looks like? So what I'm going to say is, I'm going to show you what it's going to look like for about 12 more months. And then next fall, we are launching something. What am I doing? There's the wrong place. Next fall, we are launching something that Liaison's calling CAST 3.0 or 3.0, which is a whole new application platform. It's going to have a lot of great functionality, but the elements that we are collecting will remain the same. So that's really what I'm going to show you. So it'll have a whole new look and feel to it, but basically the application is going to be the same. And how do I maximize this? There we go. Okay, so this is what the application looks like. So this is sort of a menu of the items that are categorized for the applicant to complete. Anything that has a red dot is required, or at least some of the elements are required. Anything without a red dot is not required. The applicant can stop and start their application, so they can do one section and go away and log in the next day and continue. And they can edit the information until it's submitted. They have the ability to check on the status of their application, and we actually created, I forgot what these are called.
QR.
Thank you. I was going to call it RS, a QR code. So they can actually check on the status of their application from their mobile phone, and that's one direction that we're going to be going with this applicant portal in the future is they'll be able to do a lot more from their mobile phone in the future. But right now they can check and they can see what's missing. Have they, has Liaison contacted them or SOPHAS contacted them? So I'll just run through these very quickly. So here they would fill out some personal information like their citizenship, for example, race and ethnicity. Here we ask for a variety of contact information, language proficiency, which is an optional section, additional required information. This is kind of a miscellaneous section, but we would ask about felonies and misdemeanors, for example. And hopefully they have their answer no, but this is where they would report it, and academic academic experiences. Here, they can actually, in sort of a database format, report volunteer service, honors awards, and work experience. But we also asked for it in the CV and resume. That is a required field. They have to upload a CV or resume. But the member schools really like to have the applicants to list out these 3 experiences because you can actually run statistics on it if you want to. You can export it. You can search for people who have, worked with the Red Cross, for example. You can search the text fields. You can't do that with the PDFs of the resumes. So it does have some good functionality.
Is there a field for military service?
The question was, is there a field for military service? There is. We ask about veteran, active duty, or reserve status. Other relevant information is simply a place where they can tell you something about their application that wouldn't fit anywhere else. And a lot of times they'll just explain why they had a really bad semester. But it's kind of a note to your admissions committee or to the admissions director. We do collect a number of test scores. So the applicant, I think we can see them here when I click, can self-report any of these test scores. We also receive GRE scores, MCAT scores, and TOEFL scores officially from ETS and AAMC. The applicant will report all colleges and universities attended. So they should list every place that they took any higher level courses here, including international institutions. Now this is the one that we probably spend the most time talking about, is that the applicant has to fill out all the courses that they've taken at U.S. institutions. University of Alberta is joining in the fall, so it'll be all courses taken at U.S. and Canadian colleges and universities. they have to list them all. And the applicants, of course, are not always happy about having to fill out that information. But Guy is going to show you the reason why, and I'll just explain briefly, is that SOPHAS takes this information, verifies it against official transcripts, and then calculates a predetermined series of GPAs that the schools and programs have decided on. You can also, using this coursework that has been entered and and verified by SOPHAS, you can also calculate your own GPAs. I know Eileen was mentioning this morning that she's got it set up, so you can calculate GPAs that Oregon State needs. You can also review the courses. You can sort them. There's a lot of things you can do with the coursework because it's in a database format that you could not do if you were just looking at scanned transcripts. So every year we talk about the pros and the cons. We talked about this substantially with the focus group with students we did last year, and we always come back to there is so much power to having this information, so we do ask applicants to self-report their coursework. Statement of purpose and objectives. The applicant will write a specific statement of purpose and objectives to each of the institutions to which they're applying. So if they're applying to, feedback. If they're applying to Berkeley, Minnesota, and Oregon State, they should be writing 3 different statement of purposes. So their statement should be customized for your institution. They also designate between 3 and 5 recommenders, and SOPHAS requires 2 references to be complete in order for the application to be considered complete. And those references are generic. It's important to know that we made that decision because every year we go back out to the recommenders and say, thank you for completing the process. How did it work? Did you have any problems? We also asked, do you want to be able to customize for each institution to which the applicant applied? And it's about 85% of them say, please don't make us do that because they have to write more references. So that is the reason why it's not that the schools and programs insist that they're generic. It's the references do not want to write multiple references. We do have an optional field here, a writing sample. We have instructions on this page that you should check with your institution to see if it's required. Typically, it's just PhD programs want this. So you would decide whether you wanted to ask them to submit a writing sample, but if you do, this is where they would do it. They just upload a PDF is all that happens here. And then this is where they select their designations. And I'm going to show you what this looks like because this is pretty important. And then I'm going to turn the wheels over to my colleague Guy, and he's going to show you the admission system. Okay, so we just went through this. I know that he's got an open program, so I'm going to select his. Your programs are closed, your deadlines are passed, so I can't select your school because there won't be anything there.
Environmental health.
Yeah, thank you. Okay, so you select the school or program here. And then here, if you're interested in getting an MPH in environmental health, then you can select for the different types of deadlines. Okay, so you can have as many types. You can have priority deadlines, early admissions deadlines, international student deadlines, you name it. Just whatever you have now, we can accommodate. And then you would submit your application. Oops. I've already selected Minnesota.
And that's my business rule. See? That's why it works.
It does work. You can only select Minnesota once. I've already selected. I forgot I already had it in mind. So one really neat benefit of SOPHAS is that, and you all have this with the Oregon MPH program, is that you can ask a series of questions. They can be drop-down format. They can be text boxes. But you can ask up to 15 questions specific to your campus. So you can ask, have you ever attended, Oregon State before? If so, what's your student ID number? And this is information that really wouldn't make any sense on the main application, but it certainly would make sense to your applicants. So you determine what those questions are. They show up on the application, and you can export that information in your data feed.
I just want to point out one thing, and we've added questions as we've gone along, but one of the things was for our... I need to take that too. For our scholarships, a lot of times they have certain requirements that you're not going to find out, or it'd be very difficult to find out from the application. So we ask things like, are you in the Minnesota Health Service Organization employee? Because there's scholarship specific to that, or you're a pediatric resident. And so it just is a real nice way to get the data that we need. And sometimes we get rid of questions, we add questions. It all depends on what the need is.
Okay. So again, any of you that haven't been in the application, just go to sophas.org, create an account for yourself, and just poke around. It's the best way to figure out what SOPHAS is. And it's, like I said, it's important to understand from the applicant perspective what they are experiencing. So I'm going to close this out. So the applicant submits their application. As soon as they hit submit, you can see their application. There's no waiting. We don't hold the applications. And that is when I'm going to ask Guy to show you what happens on his end.
What's the fee per school?
It's $120 for the first institution, and then every additional institution is $45. And we do have a pretty robust set of fee waivers for U.S. applicants, international applicants, and participants like in Gates, Peace Corps, Air Corps, etc.
Okay, that's good. Okay, this is WebAdmit. This is what my office and each one of the program offices use to manage their applications. A couple of things I want to point out to you is designations by application status, and this is where I look to see where is an application in the SOPHAS process. So I see that there are I have 417 in progress, meaning they've indicated that they're interested in one of our programs. They haven't submitted yet, but I have all their email addresses. So I can email the students directly from this system to say, hey, I see you're interested in us. Is there anything we can do to get you to submit your application? That type of thing. And if I would click on that, then I would get all the people that would be in that particular area. I can see that there are now 24 complete applications as far as SOPHAS is concerned, meaning all U.S. transcripts have been received and at least 2 letters of recommendation, and they're in a queue to be verified. Then I can see, okay, here's 2 people verified and 1,151 applications that have been released to us, meaning that
what's the verify means? Who is doing it?
SOPHAS is doing it.
SOPHAS doing it.
Right, exactly.
Is it like a people or is it like a human verification or not?
It is a human verification. What they do is they have 2 screens and they see what the applicant entered, and then on this screen they'll have the actual transcript, and then I just go back and forth. I've seen them do it. It's amazing.
Good job.
So then, but more importantly, this is what we really rely on at Minnesota, and these are our local statuses, and these are statuses that we have come up with. We made these statuses and got together as a group, all those of us who manage the applications, what's going to work for us so that we know where everyone is in the process. Obviously, I'm seeing all applications here because I work with all applications. But if you're EPI, you're only going to see the EPI applications. If you're biostats, only going to see the biostats applications. So it wouldn't be as daunting to the program coordinators. They only see who they have to deal with. And so it just lets us know, I know if I want to know who's still incomplete, I can click on this, and it gives me all the applications that are incomplete. All right, a couple of other things. Let's go to the names have been changed. Everybody's a demo, but I do want to show you an actual application in the system. So there are a number of things. There's menu items. There's sections within the application. You can see contact information here. Here I can see, sorry, I'm not used to a Mac. You can see what is the designation. Okay, this person is applying to our MHA executive program. I know you can give your designations abbreviations, so it's easier for you. The applicant wouldn't see that. They'd see executive program for the MHA. It gives you the idea, where's the status of this application, when was it submitted, when did SOPHAS consider it complete, and then you can see here the local status. This is what we changed. This person's matriculating, so that's this person's status. But if let's say they were an admit, and then they matriculated, then I would just go in here and change it to matriculate. So that's how we keep track of what's going on in the system.
You changed that?
Yes, that's changed actually in our office. How we work it is, go back to the dashboard here. How we work it is if a program wants to submit. This is what they would choose. They'd say to admissions office admit, and that just simply means it comes to me, I go and look at that, I go into our system of record, the university system of record, and I do an admit or a deny. And then I change the status to either deny or admit so the coordinators know that that's in process.
So who makes the decision? It's
the programs make the decision.
So there's between you and then click into admit, there's a process of faculty involvement.
Correct. Correct. Right. So what happens is when my office knows that the application is truly complete, meaning we receive the official GRE scores, we receive that third letter of recommendation, then I change the status to APPL. These are PeopleSoft terms, but anyways, it means two program coordinators, and so the coordinator knows that application is ready to be reviewed. And so then once the program coordinator will assign the application to the faculty. And so she changes it to pending. So the coordinator knows that, okay, I've sent these off to the faculty for review. And then they let me know what their decisions are, and then I change. So it's just all a process, and everybody knows. If you look up any person, you know where that person is in the process.
So the faculty say approval. The faculty give it to coordinator or give it to you?
They give it to the coordinator.
I see.
Yeah. Let me show you something here. Hopefully it's in here. Okay, this is where assignments, since this isn't live data, this is a demo site, but this is where you would see all the faculty that this application has been assigned to, and then you would also see the faculty decisions. So all the coordinator has to do is click on this assignments tab, and they're going to see where everything is. They see if the faculty made a decision, or if they can tell if the faculty has not, and then they can, bug them, get going, that sort of thing.
I have a question for you. So
yes.
in your system, is let's suppose a 10-person faculty, it was a 5-5 split. 5 wanted to admit, 5 didn't. Which person in this process makes that decision?
That's made by the programs, and each one of our programs has its own admissions committee, and all of them do things slightly different. And that's why they love this, is because we can tailor it to how that particular program does their admissions. And so to give an example, let's say epidemiology, they give scores. They don't give, they won't put admit or deny, they just do scores. And so then the coordinator will see.
I like that.
They do a regression. Look at the trends in the next 4 years.
We could model each application.
Yes.
So my other question is that I saw one field and it was called mailed, and it had 11,000. You don't have.
Yeah, it's basically the term is going away. Okay. We used to have physical mailings when this first started. It simply means verified.
Oh, okay, got it. So that just means the person at SOPHAS or whoever it is looked at
verified all the U.S. information.
With the two
SOPHAS obviously doesn't verify any international coursework; they just do U.S. coursework.
So follow up with Stephanie's question. If you have, in this process, do you have opportunity for? Is there something built in that a faculty has opportunity to discuss of that? Or you have a 10, that's a 5-5. I mean, is that coordinator to make a decision, or is it built in have a meeting for each program? They can say, we're going to have a meeting, discuss, and which way we're going to go.
Right. They won't do it through this, but what most of the programs will do, if there's really a big split in terms of what people's decisions are, they'll schedule a meeting and they'll just look at those applications.
Yes. Okay.
Rather than looking, if everybody's saying admit, there's no need to sit and discuss it. So they just have a meeting for those where there's a big split in the decision.
Got it.
Is there a way for when a faculty review an application, if a particular program has multiple criteria, is there a way for a faculty reviewer to check off, grade GPA?
Yep.
Okay.
Let me show you that.
Recommendations, question about experience.
And so this is where it comes in handy, because again, every one of our programs does things differently. And so what I do is I go and I set up an assignment type for the particular program. And so then I give it a name, like I could say it was EPI, and then I choose which of our programs this applies to, and then I can do all sorts of things. I can use questions, and this is where you say, comment on GPA, and give a score. And then I can add as many of those as I want. I can say whether or not I'm going to use overall scores. Is it entered by user, sum of questions, average of questions, and that would be for the coordinator. I can allow overall comments and overall remarks. And the overall comments means just a comment box, a free-form text field where you could just enter whatever you wanted. And then allow overall remarks. This is where you could put in, let's say like some of our committees have specific things. They'll say strong admit, weak admit, reject, strong reject. That's where I would put these here, and then the faculty person would then have to make a final decision. So it has a lot of flexibility. You set it up the way that works best for the particular committee that's reviewing.
And that can vary by program.
Yes, absolutely, and that's why I have so many.
So you work with program coordinator and tailor to each of the programs.
Right. So they let me know what they want, and I set it up. Everyone should have just one institution manager, because there's all sorts of things you can do with this. Right. But you just want one person who would do the configuration.
Right.
Yeah.
So how's the final decision made at the program level for a given applicant? In the system, how is it made?
In the system, there's no final decision other than they just let me know they changed the local status to admit or to deny. And that lets me know. So if they say admit, I go in, I set them up in the system, I send them out the dean's admission letter, and then I change it to admissions office admit to just admit. The coordinators then know that the dean's admission letter and an email notification has gone out to the applicant.
So it's office, outside the system, they let you know.
I'm sorry?
It's outside SOPHAS, they let you know the program decision for a given...
No. It's within, because again, your local status is here. Let me show you that.
So was the program coordinator?
The program coordinator is the one who lets our office know what the decision is.
Right, okay. So
yeah. And so in here's where you can see where the decisions, right over here. So the coordinator could go in and they could say, okay, oh yes, these are the people that are coming.
So the coordinator has administrative rights that are more comprehensive than...
Correct. That's correct. Right. So everyone in the system has certain rights, and you just determine what are the rights of that particular person. For our faculty, there is a thing where we could say they could see all applications no matter what, or they can only see applications that the coordinator has assigned. So there's all different ways that you can use this, again, whatever your school decides and what works best for you.
So can the coordinator assign some applications just to some faculty?
Correct.
Okay, so you
yeah.
can have
and a lot of our programs do it. It's like, okay, these three faculty will get this group, and these three faculty will get this group. All right, let's go back to a person. So, other things to look at here. You can look at...
Your conference is scheduled to end in 2 minutes.
Okay.
It's going to happen again.
You will have again, so don't worry.
But I need to, what is the timing of this meeting is till?
It's just video, it's being videotaped, and so that will shut off and
But I have more time to talk.
Oh, sure.
We're so
Okay.
efficient at OSU, that's it. Your time is up, your time is up.
So you can look at the full application PDF, meaning all the information that you can look at individually on each one of these menu items. You can just look at it. It's like a, I wonder if this will come up since it's demo. Let's see. Here.
That's weird.
Say, well, that's thinking. Oh, here's a real nice feature of WebAdmit. It's what's called custom fields. These are set up by the university. These are our custom fields. We want this information. Once we set up a custom field, it immediately becomes exportable. So we can take whatever it is in here. So you can see we have a number of things. We want to know the application complete date because we let them know in the email that we send out to them saying, hey, we got your SOPHAS application. We consider it complete as of this date because we have priority deadlines. And so that's important for the students to know. So I set up a custom field here so that I can then put that in the email that is sent out to the students. Also, the U of M EMPL ID, once we admit someone, we put their EMPL ID in.
Your conference is now over. Goodbye.
Can I ask you one question?
Sure.
I want to make sure I got something right in my morning.